I was diagnosed with scoliosis when I was 12 years old. It was actually a gym teacher that noticed that my shoulders were uneven. So off to the doctor to get some x-rays. I was at a 38-degree curve and I was immediately fitted for a brace. But back then it was a very different type of brace. It was not corrective. It was just meant to hold you from progressing further. Very uncomfortable. Very painful, really hard at 12 years old as well. Yeah, at that time I was in the brace for, I think it was 23 hours a day. So it was around the clock. Really a big commitment, definitely hard as a teenager. You know, you want to be out doing things and having fun, and then you're in this brace all the time. So it was really tough. So when I was 12 and I first started wearing the brace, I was expected to wear it for as long as I could when I was continuing to grow. I actually only ended up wearing it for 8 months because it really wasn't doing a good job of holding my spine from curving further. So at that time it was looking like I would be headed towards the surgery.
So when we look at traditional braces for scoliosis, things like a Boston brace or a Providence brace, the problem with these braces is that they're not really designed or meant to try to reduce the scoliosis. They're just trying to slow down the progressive nature of scoliosis. These designs in these braces, especially even to this day, are very similar to what they were when Amy got her brace prescribed when she was 12. And they're just kind of a squeezing style brace trying to slow down progression. They don't really change the shape of the curve. They don't alter the geometry. They don't alter the spine during this progressive nature. So they're not really reducing the problem while it's manifesting itself. So a lot of times when these patients are taken out of their brace, their curves can return or progress to what it was going to progress to anyway, because you're not really reducing the problem. So what we see in these patients that wear these types of braces, that their curves can progress through the problem, and they end up having surgery or becoming a surgical level curve. Now, somebody like Amy, her curve doesn't seem like it progressed at that moment, but more likely she wasn't weaned properly, and more likely she was told, you know, back then not to worry about her scoliosis. You're an adult, don't worry about it. And of course, now she's here at 39 with a really significant curve, much more severe, and a surgical level curve. If she had this 66-degree curve when she was 14, they would have definitely recommended surgery. So again, it was the mismanagement of what happens as she moves into the adult stage. And since the brace that she was doing wasn't really altering the structure and reducing the curve, is it that her curve just was going to become 66 degrees anyway? We don't know these answers. Definitely the management of it from that moment to now was not effective. And now she's dealing with problems as a result of the scoliosis.
Scoliosis was really, affecting me by the level of pain. Like I was experiencing a lot of discomfort, mostly in the brace. Overall, it was more of a body image issue for me. Like, a young girl, I was in cheerleading and everything was normal. And then all of a sudden I had this diagnosis that I wasn't expecting. So it was tough and having to get used to that.
The lack of experience in fitting and modifying braces is what leads to negative results, even in a brace that supposedly may be corrective. So the name behind a brace doesn't really matter. What matters is the person who's fitting it, putting it together, and modifying it for that person. So like with Amy, she had a brace that was designed to be a corrective style, but it wasn't fitting her or working with as effectively as it could until I got my hands on the brace and modified it and changed it. Now, in some braces, we can do that. Now, some braces are so limited in their design that even me modifying it will make no difference because I'm limited in material. It's kind of like getting a pickup truck to run like a NASCAR. Like it's limited in design. There's just no way I can do it. But if we have a good basic shape, then we can work with something like that in some cases. Okay.
When I first had my x-rays done here at the center, I was really surprised that I was measuring at a 66-degree curve, which was even higher than the x-rays that I had seen previously with the doctor, the chiropractor in Canada. Obviously, I was really anxious to start treatment because with a curve that size, most people know that over 50 degrees, they usually consider having surgery. So I was, excited, a little nervous, maybe a little skeptical to, see what the results could be. I'm really excited because I've had a 15-degree decrease in the curve. So even in my profession, I found it difficult to, just do my job or, stand for long periods of time or sit for long periods of time. So definitely scoliosis is something that affects you, from many levels, and not just when you're a youth, but when you're an adult too. I've noticed a big difference in, my knee pain, my hip pain. I would say that it's nearly gone.
Scoliosis is what I've seen responds very well to a very rapid change in the curvature. And the reason why, because curves, especially in the adult stage, and as curves become more severe, become very stiff. And when they become very stiff, the braces have a hard time pushing on a stiff spine. So when we do intensive care, like we did with Amy, we can get this very rapid change in the scoliosis to kind of make the brace be more effective. So we actually help the brace be more effective by actually going through the intensive program, because we can rapidly reduce the curve and, most importantly, improve flexibility. When you do those two things, you can improve their pain. And when you improve their pain, you can now they can wear the brace better, and now the brace becomes more effective. So both these things kind of work very in tangent together to deliver the very best results. And then lastly is we give them home therapy, home exercises, and home rehab to strengthen the muscle tones in the body that have atrophied over these years. You get a very good prescription along all three of those things, you get results like Amy. You start getting really good changes, and it happens relatively quickly. Now it's stabilizing that curve after this initial phase that will provide long-lasting results.
My encouragement is just, go for it. Look into it, have a consultation with them. You've got nothing to lose except for the pain, and hopefully get a reduction in your curve as well.